thing that you were watching was a little bit of information about the Henrietta Johnson Medical Center, which is a staple of our community. And actually, it's because of Dwayne. I kind of wanted in the back of my head to have the Henrietta Johnson Medical Center on for a while. And then Dwayne was like, oh, the people from the Henrietta Johnson Medical Center said they would come on. And I'm like, oh, thank you. So Shay Scott, who is the Director of Operations, thank you so much for coming on.
Thank you so much for having me.
We
I'm
are
really excited to be here.
I'm glad. Now, can you tell us a little bit for people who don't know and aren't familiar with the services offered by the Henrietta Johnson Medical Center?
Sure. Henrietta Johnson Medical Center is a federally qualified health center. We provide family services. We have a family practice. We also provide pediatric care, which would also include adolescent, of course, adult medicine and senior care. In addition to that, we have services dedicated just to women. So we have a women's health department as well as a full dental practice as well. So we try to fit the whole range of services under one roof. Within our family practice, we also have an integrated behavioral health model. So the really awesome thing about that is if when someone comes in and if the doctor suspects that there's some things going on, someone could get screened and they would have the opportunity to actually sit with our behavioral health consultant that day and start to receive services.
And that's for people of all ages, that behavioral health service?
Absolutely. Pediatrics all the way through seniors as well. Yeah, absolutely.
That's great, because I was right before the show started and you weren't here yet. I was saying all of our guests has something to do with violence. And what you just said, because I said it's not just a matter of a bad kid or a bad teenager.
That's right.
There's other things, and knowing that the center can help them, that's some good. Because a lot of people that I found out in Wilmington just are not knowledgeable about things available to them.
Absolutely.
Yeah.
Absolutely. I like to think of it, Henrietta has the resources that maybe some community members don't have. So it's not that, more than anything, is that families may be under-resourced. We have those resources, so we're able to share those resources with the community, and it does not matter if someone is insured, if they're not insured, if they're underinsured. We have the resources to make sure that people can still get medical care, dental care, behavioral health care based on their family size and their income through a sliding fee scale.
Now, that's amazing to me. And the other, like I didn't really live in Delaware until I was an adult, but throughout my entire childhood and teenage years and coming back, I would always hear about the Henrietta Johnson Medical Center. You know, and it was always like knowledge in the back of my head, which is why I wanted to have representation on the program. But what I wasn't aware of is, can you talk about the locations? Because I always thought there was one little place in Southbridge.
No, absolutely. Yep, so we do have our flagship, or, you know, our Henrietta Johnson Medical Center in the Southbridge community, where we have been for, you know, about 50 years now. You know, so we have that. Then we also have a practice on the east side of Wilmington at 7th and Lombard. And we have a third practice that's located in Claymont in the Claymont Community Center. So we're a little spread out.
Now, there's one other aspect of this medical center that I wanted to talk about. I noticed just in looking at some of the resources available online is that you also gear your message toward healthcare professionals who might have a different career experience at the medical center than they would at like a larger healthcare facility. Can you talk about that a little bit?
Sure. So what we have, kind of like a training ground, if you will, we have providers who want to actually practice community medicine and actually provide care that's outside of private practice. So what does that mean? That means we have providers who are actually they know that we're dealing with complex patients. They know that there may be some needs that need to be provided more. So we also bring physicians in who are in training, or physicians who say, hey, you know what? We want to provide community medicine. And so it's like that.
Yeah. Did you have anything else?
Oh no, that was my main thing right there. Because once again, I think the community, even though you're in Southbridge, I think the community needs to understand all the different things that you provide. Because I know I was dealing with someone one time and they said, Dwayne, when I give you advice, you go and call them up or do
Yeah.
something. But there's so many people who I hear, I don't know where to go.
Yes.
Now they know where to go.
Absolutely. We have social workers on site who are able to help. So if someone is saying, oh, maybe I need some assistance with food, we're able to help with that. If people are like, I just lost my insurance, what can I do? We actually have staff on site who are actually able to screen someone and see what they're eligible for to get them coverage so that they can get what they need. Right now, we're really trying to get people to realize the importance of preventative medicine. So what is that? Those are some screenings that we're able to, maybe if there's something going on, we can catch it before it is too late.
Right.
So we have a nurse navigator on site that we're really, really excited to have. Her name is Crystal Wright, and she's really focusing right now on colorectal cancer screenings, breast exams, so the mammograms, as well as prostate. So we're really, really excited, and we want the community to know, don't let the fact that you may not be insured hinder you from getting the care that you need.
Shay, I'm really glad that you're here today, and I'm glad that you have a relationship within the upper room now. So when you have healthcare screenings, when you have anything that you want to promote or talk about, please have Ella come to us, you come to us, you have my phone number. We really want people to know where they can go to get help.
Thank you. I
You're very
Because if
appreciate
not,
it.
I'm coming back down like I did before.
And thank you, Dwayne,
Absolutely.
for facilitating this. I appreciate it.
Yes, so do I.